Hi, my name is Tori Nyland, and I chose polycystic ovary syndrome, or PCOS, for my presentation. So PCOS is a condition that directly affects a female's hormones. It leads to a hormone imbalance, which can also lead to a variety of other symptoms, such as irregular menstrual cycles, cysts on your ovaries, hair growth on your face and body, and it can also lead to other diseases such as diabetes and/or heart disease. Currently, there is no cure for it, but there are some medications that can help improve the hormone balance and therefore lead to improving your menstrual cycle or help you conceive or decrease the hair growth. A little bit more in-depth look at what PCOS is. So like I said, PCOS directly affects a woman's body and her ovaries and the hormones that they produce. The luteinizing hormone, or LH, and the follicle-stimulating hormone, FSH, are two hormones that are essential in reproduction for females. These hormones are released in response to stimulation by the gonadotropin-releasing hormone, or GnRH. GnRH pulses from the brain affect the levels of LH and FSH secretion. The faster the pulses, the more LH production, and the slower the pulses, the more FSH production. In women with PCOS, increased GnRH pulsation leads to an increased ratio of LH to FSH. The elevated LH levels also stimulate the production of excess testosterone, which is what leads to the excess hair growth on the face and the body. It is also important to note that just because there's a higher LH level doesn't mean there's a lower FSH level than normal. It's just that the ratio is a lot greater. Here we have two diagrams. On the left, we see a feedback loop for someone that does not have PCOS. And on the right, we can see the difference in someone with PCOS, that there is a much more stimulation and production of the luteinizing hormone rather than the follicle-stimulating hormone. Here is another look with a little bit more pictures. In the blue on the left, you can see the GnRH pulses. They're consistent, there's not that many, which lead to the same LH pulse output, consistent, not too many. And at the bottom picture on the left, you can see a woman's ovary and the stages it goes through during ovulation and the whole menstrual cycle in general. Whereas on the right-hand side, you can see the difference in the GnRH pulses. There's much more of them, and they're irregular, which also then leads to irregular and much more LH output. You can see in the picture that there's a bunch of tiny little bubbles, it looks like. Those are the cysts that are on the ovaries. They essentially are just follicles that haven't been able to mature because there has not been enough FSH production. Some of the signs and symptoms, like I said, are the ovarian cysts, increased testosterone levels, and the central obesity. Working from the bottom up, central obesity is any type of weight gain in the abdominal area. And as we know, when you do have a lot more weight in that abdomen area, it can lead to other health factors, and in this case, such as heart disease or diabetes. The increased testosterone levels are what causes the excess hair growth on a woman's face or the rest of her body. It could be her chest, her back, her arms, her legs, anything. It is important to note, though, that just because there's an increased level of testosterone doesn't mean that there's going to be other male symptoms. Like, her voice will not change. That won't happen. It's just the hair growth. And the reason I have cysts in quotes is because they're not actually cysts. They are just fluid-filled sacs that form when the ovarian follicles are not developed fully due to the hormone balances. They just have the same appearance as a cyst. It is also important to note that not every woman with PCOS will have ovarian cysts, and not everyone with ovarian cysts doesn't mean they necessarily have PCOS. Here's the diagnosis of PCOS. Typically, if you have 2 out of the 3 symptoms of cysts on your ovaries, irregular menstrual cycle, or high androgen levels, which is testosterone, there's a good chance that you will have PCOS. Pelvic ultrasounds can also be done. They are able to take a look at your ovaries and see if you do have cysts on them and how big they are and all that. The other way to figure out if you have PCOS is blood tests to test for the hormones. If you have an overproduction of testosterone, that's a good indicator. They can test for your LH and FSH ratio, another good indicator like we talked about, as well as your fasting blood glucose. This is because women with PCOS tend to be a lot more insulin resistant, which causes their fasting blood glucose to rise. Some of the benefits of exercise for women with PCOS is their metabolic response to it. Like I said, they could have insulin resistance, which causes their bodies to produce more insulin, and over time causes their blood glucose to rise. We know from our diabetes presentation that exercise can help insulin sensitivity. Their hormonal responses is that exercise can lead to them to have more regular menstrual cycles and help with ovulation and increase chances of getting pregnant. And then lastly, but certainly not least, is the psychological responses. Symptoms that come with PCOS, such as weight gain, infertility, hair growth, can all be really negative triggers for women, and it can lead to them developing severe anxiety and depression. We do know that regular exercise is really, really beneficial to help alleviate those symptoms of anxiety and depression, and it also helps you lose weight, and like we talked about, regulate your cycles and all that. So it all kind of snowballs together. In this graph here, we are looking at a comparison of someone's insulin levels with PCOS and without PCOS. In the highlighted on the left-hand side with the red dots, that's with PCOS, and without the red dots is without PCOS. As you can see, as their BMI gets higher, their insulin levels also get higher. That's just, if you have a smaller BMI, you're just overall more healthy, and as your BMI gets higher, it's harder for your body to use the insulin correctly. Here's just another graph showing insulin sensitivity. The more resistant to insulin you are, the higher the secretion is, because your body doesn't think it's working. So we also know that when you are active, it helps your body use the insulin properly. That just shows you right here that the sedentary point and the active point, there's a big difference in insulin sensitivity. That's a great factor for women with PCOS. The management and treatment of PCOS, like I said before, unfortunately, there is no cure for PCOS. And based on the individual's preferences, you might have a different way of managing it. For example, if you want to regulate your menstrual cycle, the best bet's probably going to be birth control pills. Birth control pills are composed of estrogen and progesterone, which help regulate your cycle anyways. So with that added help, it might get your body back into a normal cycle. On the other hand, if you are trying to get pregnant, obviously, birth control pills are not going to be the most helpful. Your doctor could prescribe a prescription called clomiphene. And what that does is it actually helps induce ovulation. So that's the whole problem with PCOS, is the follicles are not maturing to the point at which you can ovulate. So hopefully the goal of this prescription is to help that. Another concern of many people would just be improving their overall quality of life, losing weight, decreasing the risk for those other diseases. And medication that could help that would be metformin, which is actually a diabetes drug that helps increase the insulin sensitivity. My mom is a type 2 diabetic, and she's been on metformin for as long as I could remember. Here's our case study. Bailey is 28 years old. She is 5'5", 170 pounds, and she's been diagnosed with PCOS. She has tried birth control in the past, but she did experience other side effects not related to PCOS and wants to try a little bit more natural approach. She has a BMI of 28, which puts her into the overweight category. She's at risk for type 2 diabetes because she is so insulin resistant. Her goal is to regulate her menstrual cycle and improve her overall quality of life by losing weight and decreasing that risk for type 2 diabetes. Some of the tests we performed would be the fasting blood glucose to see just how insulin resistant she is. That waist to hip ratio, because although her BMI puts her in the overweight category, we do know that that's not the most accurate, and it's good. The waist to hip ratio is a little bit better in determining the abdominal weight gain, and as well as a Bruce treadmill test just to see what her exercise capacities have been in the past. Based off of that, we want to do an exercise prescription of aerobic exercise 4 or more days a week. Moderate to vigorous intensity is going to be most beneficial for women with PCOS. We want to start out at 10 minutes a day and increase to at least 30 or more if she'd prefer. This can be super easy to incorporate into your daily life. You can take a walk, go biking, swimming, if you have a water aerobics class, anything like that. It is the easiest way to incorporate that into your daily life. Resistance training, we want to do 2 to 3 days a week. Again, moderate to vigorous intensity. We can start out a little bit easier, especially since her Bruce treadmill test wasn't the best. She probably isn't the most athletic. You could do the lower end at 6 exercises with like 1 to 2 sets, 8 reps each, and gradually increasing the exercises, the sets, the reps, and the weight as she gets better. And for this, we can go to a gym. If she has free weights at her house, we can use all that. And of course, flexibility. We want to do at least 3 days a week. Every day is the most beneficial for anyone. Stretch to the point of tightness for static stretches, 2 to 4 reps, 10 to 30 second hold, and like I said, static or dynamic stretching. Some special modifications that we need to keep in mind is because she is pre-diabetic and we want to get out in front of that and test her blood glucose before her exercise to make sure she is in a safe range. On the same note, we need to make sure that we are aware of hypoglycemia and incorporate a lengthy cool down to make sure we can avoid that as much as possible. It is also important to note that even though there's an increase in testosterone, that does not mean she can lift a ton more weight. So we need to treat her like normal, start out with lighter weights, and work up progressively. Another thing is we have to remember that along with this disease, a lot of people have anxiety and depression, and there may be days where she just can't do it. So we need to be cautious of that and encourage her wherever she needs it. In conclusion, incorporating moderate to vigorous intensity exercise into the daily life of someone with PCOS is going to be the most beneficial, increasing their quality of life. Like I said, it's going to assist them in losing weight, regulating that menstrual cycle, increase your chances of getting pregnant, and decrease anxiety and depression. A lot of these all go hand in hand. It's not like one thing doesn't affect the other. For most of the symptoms that with people with PCOS, one thing is going to affect another. So if you lose weight, you're most likely your menstrual cycle will be more regular. If your menstrual cycle is more regular, maybe you're happier. As I was researching this topic, I realized that the way in which exercise is beneficial to people with PCOS is the same way it's beneficial to everyone and everyone. Just because I don't have this diagnosis or my male classmates don't, doesn't mean that exercise won't benefit us in the same way. It's just the side effects aren't as apparent. Thank you.